I think you're good to. I'll keep watching. So, Marilyn, you ready?
We're ready. All right. Thank you all for joining us this afternoon. I'm Marilyn McComb, the Executive Director of the ARC of North Central Virginia. We support people with developmental disabilities and their families. And we are very excited to present today's workshop today, Creating a Calmer Nervous System in collaboration with the Mental Health Association of Fauquier County. Today's host is Jane Probst, a licensed clinical social worker in Culpeper. She's trained as a certified brain spotting consultant, Evergreen certified clinical trauma professional, a traumatic stress psychotherapist, and also a certified safe and sound protocol provider. Jane is a fascinating and articulate speaker, and I hope you will all enjoy learning from her this afternoon. Welcome, Jane.
Thank you. Thank you, Marilyn. It's really a great opportunity to be here. I'm really happy to talk about this social impact grant that I was awarded back in the first part of May. And I know that we have just a brief time to spend together, so I'd like to dive right into the parameters of the grant and to talk about Safe and Sound, what it is, have an opportunity for people to ask questions. And I know that we have a wide range of people that are attending today. Some are professionals and some are seeking treatment or wanting to know more information about Safe and Sound for themselves or for their family. So Christine, if you want to start with the PowerPoint, and while you do that, I can at least begin to talk a little bit about the Safe and Sound Protocol grant that I was awarded by Unite. It is a grant that allows me to offer access to some pretty profound healing through these three pathways through Safe and Sound Protocol that I have identified here. Safe and Sound Protocol was developed by Stephen Porges after about 40 years worth of research looking at our autonomic nervous system and some of the important reasons, what he refers to as our biological imperatives that keep us in healthy relationships or move us toward healthy relationships. So Safe and Sound Protocol is filtered music, and it's up to 5 hours of filtered music that the individual can listen to. Individuals can listen to it. Families can listen to it together. And that's a process that a certified Safe and Sound Protocol provider would guide the individual and the family through. So to look at Safe and Sound, you see this great little GIF here that we have that shows how interconnected these three pathways are. And the music is filtered. There's an algorithm that's applied to specifically selected music. The first pathway is Connect, and this is the only pathway that is not filtered. So this music is selected specifically because it does have just a natural calming impact on our central nervous system, on our autonomic nervous system. The second one, as you're circling to clockwise, is Core. And this is the primary filtered playlists. And when I talk about filtered music, we have a very structured treatment plan that we developed that guides you through the possibly 5 hours of the filtered music. There are a total of 5 hours. They have to be listened to in succession, but you don't have to listen to all 5 hours in order to successfully complete the treatment. Depending on what your nervous system responds to, it's quite possible that you might listen to the first 5 minutes of each of the progressive hours, or maybe just 3 minutes of each of the progressive hours. I have a young man now who's currently listening to 20 seconds of microdosing of starting with hour 1, and we are just working on him achieving 3 minutes of hour 1 before moving on to the first 3 minutes of hour 2, and then hour 3, and then hour 4, and then hour 5. And so this is something that I discuss with every individual as well as every family, based on assessments that they would complete, so that I'm aware of how their nervous system, their autonomic nervous system, responds to threats as well as safety. And then the third pathway is balance. And balance is an integrative playlist that can be used either alone by itself, or it can be used to titrate between core and balance in the treatment plan. It can also be used after Safe and Sound, after the core, SSP core, has been listened to. SSP balance can be listened to after the 5 progressive hours have been completed. And typically what we do is we wait, once the 5 hours have been completed, we wait 6 to 8 weeks, preferably 8 weeks, before we resume a different treatment plan based on the gains that the individual has made from the first round of listening. And I hope that that makes sense. I'm open to any questions that anybody has at any point during today's presentation. Christine, you want to move to the next slide, please? So we can't talk about Safe and Sound protocol without talking about the polyvagal theory. And polyvagal theory was developed by Dr. Stephen Porges. And there's a lot to discuss. There's a lot to unpack about polyvagal theory. And we're going to keep it relatively simple and look at the 3 main responses, the 3 main response states that Dr. Porges has identified. We've all heard of fight, flight, freeze. And so this is a stress response, a reaction actually, more than a response. We can't control fight or flight. We can't control freeze or collapse. And so these are states that ensure that we remain safe during moments of imminent threat. The third, obviously, is the social engagement, and this is what we're focusing on with Safe and Sound protocol, is to enhance our social engagement response so that we are engaged in healthier relationships. So if you want to advance to the next slide, we can take a look at here some of the, actually, if we can move to the next slide, I want to talk about the, yeah, here we go. So Safe and Sound protocol, using the polyvagal theory as a foundation, looks at cranial nerves. Polyvagal theory is about the vagus nerve, and if you look at the slide that has the underside of our brain, you can see all of these little branches coming out of the underside of the brain, and these are the 12 cranial nerves that are involved, believe it or not, in the delivery of Safe and Sound protocol, particularly the vagus nerve. And you'll see the yellow nerve that's coming out from underneath. the vestibular cochlear nerve that goes into from the pons there in our brain into our auditory system, into our vestibular and auditory system. So vestibular is balance and auditory is hearing. So when we hear music through air conduction, it comes through the ear canal, it vibrates the eardrum. And when the eardrum vibrates, it moves the inner ear along with the muscles and the middle ear bones. And in some instances, some of the middle ear bone muscles are not fully functioning, particularly the stapedius muscle. And so what Safe and Sound does is this algorithm of filtered music exercises the stapedius. And Christine, if you can go back to the previous slide, I'm sorry. So you can see on the top how an inactive stapedius doesn't transmit human voice as effectively when the stapedius muscle is ineffective. And you can see the pink is the environmental sound that overwhelms human voice. And so with a fully functioning stapedius muscle and the other muscles in the middle ear, along with the bones, you can see that environmental sounds are minimized and that attunement to the human voice increases. And so this took 40, 50 years worth of research, Dr. Porges, looking at what primarily people that were on the autism spectrum, exactly what is it that prevents people that are on the spectrum from spontaneous engagement? What prevents them from spontaneity? And looking at heart rate variability, looking at the development of the vagus nerve prenatally. And one of the things that he discovered in working with preemies and sudden infant death syndrome was that he found that quite frequently that the ventral vagus nerve was not as fully developed as it could be. And this is the myelination, the development of the vagus nerve really takes place in utero in the last 3 to 4 weeks. And so children that are born prematurely don't necessarily have a fully developed vagus nerve. And that impacts their ability for self-regulation, and especially for newborns, babies aren't able to maintain their body temperature, their heart rates. And so following his research brought him to social engagement. And that's how polyvagal theory developed over time, because we, as human beings, need social engagement. We need healthy relationships in order to thrive. We need healthy relationships in order to heal. Right, Christine, if you want to move into the next. Yep. So I'd like to break for a few questions. If anybody has any questions, if there's anything in the chat before we move on. Nope.
I had a question.
Yes.
I'm Janelle. Hi, thanks for inviting me. What does it sound like? I guess I'm curious. The filtered music. Yeah.
So there are, in core, there are 4 playlists. Some are instrumental and some are lyrical. And you'll hear as you're listening, we recommend that the individual wears over-the-ear headphones. The outside of the ear is instrumental in transmitting sound and vibrations into the auditory system. You'll hear some bilateral quality to the music as you're listening. At some points, the music may be kind of fuzzy, and it's important to pay attention to the music while you're listening, typically in a very quiet environment where there aren't any fans or outside noises. So we don't want to listen while we're in the car, obviously, while we're driving. We want to be in an environment that is as quiet as possible. Movement is okay. Kids can play with toys, adults can move around, you know, do some gentle yoga, walking, preferably indoors and not outdoors. So the music will require active listening.
Thank you.
Jane, I just wanted to mention that some of the tracks, depending on what you pick as your preference, can be songs from your past. Let me just say, so they can be very familiar songs or more classical music, but you get to choose, and Jane would walk you through that.
Right. So there are 4 different playlists. 2 of them are lyrical. Some of them are for kids, like Disney music. Some of it is like, you know, 60s, 70s, 80s, soft rock, classic music. And then there's the classical instrumental music as well. So there's a fairly wide variety of music that you get to choose from in each one of the pathways. Connect has 5 different playlists, Core has 4, and Balance has 4. Any other questions? And all of this information, when I meet with people individually, I review everything. So this is really more of an overview of Safe and Sound program that I'll also review with the individual if they're interested in pursuing Safe and Sound as a treatment. Do you want to move to the next slide, Christine? So this identifies a little bit more of what I was talking about with the 3 pathways: Connect, Core, and Balance. So Connect is unlimited listening. It is unfiltered music, but it's music that's selected for its frequency and its range in calming the central nervous system. And I use Connect quite frequently if we're titrating with Core, which is the filtered music. Sometimes people can be a little overwhelmed by Core. And so it's important to follow the treatment plan for Safe and Sound. But I frequently incorporate Connect for people to take a break. And I also use Connect for people that are having difficulty acclimating to headphones. So sometimes children resist headphones, and, you know, kind of helping them adjust to the headphones. We can use Connect without there being any intervention to the music. And so also too, people use Connect. They play it on their cell phone without using headphones. So Connect is not necessarily something that you have to use headphones with. Core is the prescribed listening. And this is the filtered music. This is highly filtered music, and it's progressive. So hour 1 is lightly filtered. The algorithm is more of an exercise. You know, if you start an exercise routine at the gym, you don't start out lifting 500 pounds. You have to start very gently and work your way up. And so hour 1 is a very gentle introduction to the filtered music. And the first 15 minutes of each one of the hours, the first 15 minutes has the full filtration in the music. And then it's repeated 3 times within the context of that hour. Not everybody needs the full hour, as I'd said earlier. So sometimes people are only going to need maybe the first 15 minutes or maybe the first 5 minutes. If somebody's really struggling and they need stabilization pretty quickly, I'll use Core to stabilize them quickly. And maybe they just listen to the first 5 minutes of hour 1 on day 1. Maybe they take a break with Connect the next day. And then on the 3rd day, they go to hour 2 for the first 5 minutes and then Connect, and then titrating between the first 5 minutes of every hour and Connect in between, or maybe balance in between, just to have some stability before we move on to the full, maybe 15 minutes or maybe the full hour. So you get the full filtration of Core within the first 15 minutes. Does that make sense? Does anybody have any questions about that?
I have a question.
Yes.
So to me, it sounds like that if you use the phrase of like, if somebody's struggling more, they listen to less time because that's all that they can handle. And so you'd say, like, for somebody who's not, like, their nervous system is more balanced, they would be more likely to listen to the full hour or so, or
It depends.
okay.
It depends on what someone's nervous system can tolerate. And I don't mean tolerate that you got to gut through it sort of way. We want to be able to have effective listening take place without dysregulation. The moment that dysregulation shows up is the moment that you stop.
Okay.
Right? And so if somebody, if they do the assessment and I think, okay, somebody really needs some stabilization, let's listen to 5 minutes. If they're 2 minutes in and they start having some side effects, I tell them to immediately remove the headphones. Don't deal with the program first. Remove the headphones first, and then you can stop the program. But we want to find out what that outer limit is, right? And there's absolutely no reason to gut through 5 minutes more or 15 minutes more or 45 minutes more. That's why it's really important that while an individual is listening to Safe and Sound protocol, that they work closely with their clinician.
Okay.
So yes, go ahead, Bridget.
So are there side effects to this, and are the I mean, I know there's positive side effects, but for the negative side effects, so they show up right away, or could they show up like in a week after listening?
So the side effects, the negative side effects, they're going to show up pretty quickly. They're going to show up within a 24-hour period. And that's why it's really important to go slow initially. As I was saying before, hour 1 is very gentle. It's more of an introduction. Hour 2 steps it up a little bit more with more filtered music. The filtration's a little bit stronger. Hour 3 is really the workhorse. So if people are going to have any side effects, that's why 1 and 2, it's really important for hours 1 and 2 for me to be a part of that and paying attention. Because if you're having some negative side effects with hours 1 and 2, hour 3, you have to go really slow, because hour 3 is really the workhorse. Hour 4 is starting to close the filtration, the treatment. And so hours 4 and 5 are more similar to what hours 1 and 2 were. They're more gentle, and wanting to complete the treatment, if that makes sense. So hour 3 sometimes kids have stomach upsets. There might be some bedwetting for kids. There might be some tummy issues. There might be some sleep issues. There might be some nightmare. So that's one of the reasons why it's really important to take a thorough assessment prior to treatment And that's why it's really important to work closely with the Safe and Sound protocol provider so that you can avoid those negative side effects. Sometimes people will have maybe some fuzzy cognitive issues. They might have some ear ringing. I will say that tinnitus is one of the things that I'm very, very cautious about. The moment that tinnitus shows up, we have to either stop it completely or go super slowly. Some people, tinnitus resolves while they're listening, and other people, it does not. So in the assessments that we use in the clinical interview that the individual goes through, any kind of auditory issues are fully discussed along with any other medical issues that an individual might have.
But the medical issues could be, related to these, nervous conditions. So do you connect people with an ear, nose, and throat specialist to kind of work out those things in conjunction with the other things?
So if somebody has some auditory issues, I want clearance from their provider first before we'll engage in Safe and Sound protocol. I'm not going to risk anybody's auditory systems unless they have a full understanding, and their ENT also, or their audiologist also has a full understanding of what they're engaging in.
Thank you.
Mm-hmm. So how does Safe and Sound connect with the vagus nerve? And we've heard a lot of information about just within the social context of vagal stimulation and how we can improve our vagal tone. Most people have heard about diaphragmatic breathing or tapping. And so how the vagus nerve and polyvagal theory interact with Safe and Sound protocol is that through those cranial nerves, through the vestibular cochlear nerve. And Christine, if you want to, can you go back to that diagram of the inner ear? And you can see the vestibular cochlear nerve, and right above that, when you see the cochlea, right above the vestibular cochlear nerve is the facial nerve, right? So cranial nerves innervate, are responsible for orientation for the head, neck, and shoulders. And so you can see how the vestibular cochlear nerve is very, very close to the facial nerve. And just in the pons, medulla, and diencephalon parts of the brain where the cranial nerves exit in pairs, you see how close and what close proximity all of those cranial nerves are to the others. And as these cranial nerves exit, in general, about 80% of those fibers that exit on either side cross over. So from right to left, left to right. And when you have these 12 pairs of cranial nerves intersecting, information is shared. So auditory information is shared with vision. Balance information is shared with olfactory, right? And the vagus nerve, which is the longest nerve in our body, comes out alongside our carotid artery on both sides of our neck. One branch goes in front of all the internal organs in the front. The other branch goes through all the internal organs in the back and connects to all of our internal organs. And so when these cranial nerves are sharing information, they're also sharing information with the vagus nerve. And the vagus nerve is responsible for rest and digest, right? So what happens when our vagus nerve is effective, if it's toned and it's doing its job efficiently, you have more access to what Dr. Porges calls the vagal brake. brake, right? And what that vagal brake is that it releases acetylcholine. Acetylcholine is the very first neurotransmitter that was ever discovered. And acetylcholine stops the release of adrenaline and cortisol. Stops the release of adrenaline and cortisol. So when our vagus nerve is efficient and doing what it's supposed to do, it helps regulate how much adrenaline and cortisol goes into our system. So if you have an individual with PTSD or some history of trauma, or someone who may have some developmental delays and they're highly reactive, by exercising through Safe and Sound protocol, by exercising these small middle ear bone muscles that then increase vagal tone and vagal efficiency, you're giving them more, you're allowing their system the ability to self-regulate or co-regulate with another healthy individual. Does that make sense? It's a pretty big concept that here we are talking about auditory input, filtered auditory input, regulating our vagus nerve, improving our vagal tone and vagal efficiency. It sounds like a pretty big leap. And so I want to make sure that I take time to answer any questions that come out from this. We're good?
I was gonna say earlier, Jane, to talk about what Gabby said. I kind of see this, and correct me if I'm wrong, it's almost like each person gets a prescription for how they're to use this. And so
Yes.
it's individualized, and every person's listening is going to be different and
Yes.
tailored towards anything they've experienced in their life previously. And that's why all the questions you asked us, and then you go through and make us a plan. So it's not
Yes.
like we're just listening randomly. It's a prescribed treatment therapy.
Yes. It's a highly prescribed treatment.
Mhm.
You check in with me daily, at least for the first couple of listenings, maybe for the first week. It depends on how long you're going to be listening. I ask people to make sure that they let me know how they slept, how their digestion has been, any headaches, any eye fatigue, any sensory shifts, any sensory changes. I have to know about that immediately so that we can make adjustments and determine how you want to proceed. And I will say, I talked earlier about headphones. I have some people who can't tolerate headphones, can't tolerate it. And so they listen to it from their cell phone, and there's still benefit from it, even though they're not getting the bilateral nature of the music, stronger in one ear over the other or simultaneous. There's still benefit to their central nervous system.
Okay.
And I know a couple of people that are on here who have not used headphones, and have had some success.
That would be me. I've been using it, admittedly not in the best of environments, but I have a son with Down syndrome, and I was hoping that this would help him with his self-regulation. And I use it in the car because even though he'll use headphones with his iPad to listen to a movie, he wouldn't use them to listen to this music. So I thought, okay, I've got him trapped in the car for 20 minutes He can't go anywhere. He's strapped in. I'm gonna, gonna try this and see, it's through the phone, and, you know, and see how this, how this can impact, his ability for self-regulation. And so we've been using it, and, I definitely see a difference. I mean, it's not perfect, but, in the beginning, he wasn't real, I wasn't tuning into his usual radio station. So he was a little concerned about that. But he kind of quickly acclimated to our routine. There's, I leave when we leave the house, when we get to a certain point, I stop the music, and go back to his usual, you know, 80s, 90s, music. But and and there's some days I might actually go a little bit farther, farther along with the safe and sound protocol, because it really seems to be helping him, with his being calm. And it's not in the headphones for me either, but I do find benefit to it.
That's really
So
good.
yeah, it is. It really truly is.
So even under less than ideal circumstances, Lynn has found a way to make this work for Mark, and make it work for her too. So, if you're playing it over the phone, everybody's going to get a dose. Everybody's going to get a dose. In my private practice, I have kids who come in, and I will have Balance, the lightly filtered playlists. I will have Balance in the background. And kids will come in and they're elevated, they're pissed off about something, frustrated with mom or dad or something that happened at school. And within about 10 or 15 minutes, they're ready to engage. And insight happens, right? They're able to see the shift. And so for parents who are struggling, to get safe and sound into their kids, school systems are a great opportunity to get safe and sound into sensory rooms, for example. People that have private practice that work with individuals that are volatile, or come in frequently and have difficulty self-regulating in order to be able to co-regulate, right? Because we want co-regulation with the people that we work with. And so to get them into that co-regulation state, safe and sound can help kids, individuals, adults, it doesn't matter what age, to help them get into that attuned space that's necessary for therapeutic purposes, or academic purposes, or relationship purposes. So there are lots of applications for safe and sound protocol in a wide range of settings. So I wouldn't necessarily think about it in a one-on-one therapeutic session. That can certainly take place. I have people that come in and they're in my office and listening. And it used to be that we thought 5 consecutive days of listening to all 5 hours was the delivery of safe and sound protocol. And we've backed off from that because it's not realistic. Just because something's an evidence-based protocol doesn't mean that it's an effective evidence-based practice, right? IV antibiotics, that's a really fast delivery of a medical treatment, but it's not practical. So how do we make safe and sound practical so that it's incorporated into our daily lives for the benefit of the individual, but more importantly, for the benefit of the relationship that individual or those family members are in? There's a fabulous clinician down in Florida who works with families. She'll work with the individuals in the families. And we always want to work with the parents first, right? Before we work with the kids, because we want the parents to be self-regulating, right? So that the kids can co-regulate. And so she works individually with all the family members. And then she comes in and has all the family members listening to the same program at the same time, right? She'll have a splitter that everybody's got attached headphones, and she has a splitter that she'll have plugged into her phone, and she can have up to 5 or 6 different people listening at the same time. And what a wonderful family event, even if it's just 15 minutes a week of co-regulation, of people listening together and going, oh yeah, okay, we're all in sync, we're all in unison.
Now, Jane, sometimes Mark will fall asleep. I continue the music because I'm listening to it, but I'm just curious about what the impact is, particularly since he doesn't have the headphones on, for the music that's still going on, but while he's in a sleep state.
So that's a really good question, Lynn, because it happens frequently that people are listening with their headphones and they're doing it late at night. We suggest that people sit up or they move around while they're listening frequently so that they don't fall asleep. Because this is an active listening process rather than a passive listening. But there's no downside to it. There's no negative to it, particularly with balance, if somebody falls asleep with balance. And fortunately, the program, when you listen to any of the playlists, you set it for however long you want to listen to it, right? So 30 minutes, it's going to turn off at 30 minutes. So it's not as though once you start, you move automatically through all 5 hours, right? So it will be limited. It's not ideal, but there's no, I mean, I've not had anybody who's had any adverse side effects because they've listened to it while they fell asleep. And ideally, you know, as I was saying before, the first 15 minutes of every hour has the full filtration, the full algorithm, and then the remaining 15 minutes are repeats of the first 15 minutes. So if you're listening to the first 15 minutes, you're going to get everything anyway, right? And if you're listening to 30 minutes of each hour, you're going to get a double dose. So if you're fearful that you're missing something, you're going to get it later, right? There's enough repetition in the 5 hours that that the individual's not going to miss anything if there hasn't been any active listening. Does that make sense? Okay. All right, Christine, you want to advance? Well,
Got this one. You want next one?
Yes,
you
so if you can go back to because we didn't really talk about the core and the balance. So balance is lightly filtered. It is not foundational. You can listen to any hour of balance anytime for as much time as you want. There are 4 different playlists, and usually after somebody has completed the core, I let them have balance, and they can listen to all 4 playlists of balance as much as they want, as frequently as they want. It started out sort of like, I think, you know, Dr. Porges was looking at balance being an SSP light. And it's just turned into an integrative pathway that we can use in between the rounds of listening. So ideally, you listen to your prescribed treatment plan, you take a break for 8 weeks, do another assessment to see where your gains were made, and then a new treatment plan is developed for the second round. And because I have this grant until April of next year, it's possible for someone to have 3 or 4 rounds of Safe and Sound. So the healing potential for everybody who listens is profound. You know, for some of you who have done round 1 of Safe and Sound and you've experienced the benefits, just wait until you have round 2 or 3. It's pretty profound. It's pretty profound. Okay, Christine, if we can move to the next one, I'm cautious of the time. So, you know, what is the SSP? There's a website, there's a link that on the very last slide, www.whatistheSSP.com. And that will give you a lot of information. It's an integrative therapy. And so what does that mean? It's an integrative therapy. Well, it means that it fits any other therapy that you might be working with. SSP was initially developed for occupational therapists. And then Bessel van der Kolk, who is a psychiatrist out of Boston, met Dr. Porges and found out about Safe and Sound protocol, and it quickly became part of a psychotherapy perspective. And so I use Safe and Sound protocol with play therapy with kids. I use Safe and Sound protocol. I don't use it simultaneously, but I will integrate it with brain spotting or with cognitive behavioral therapy. There has not been another modality, psychotherapy modality, that I have found that isn't compatible with Safe and Sound protocol. Safe and Sound protocol can be a standalone modality as well. I've only had maybe a couple of people who, in my practice, who were not, SSP was not appropriate for them. And it's people that are in a full psychotic episode, anybody that has a history of psychosis, people that are bipolar with manic episodes. You have to be very, 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 very careful and have a full mental health history to rule out people that have psychosis, because it is not compatible. It's not recommended for people that have a history of psychosis. And we were talking earlier, you know, we're all neurodivergent, right? We're all on the human spectrum. And aside from psychosis, schizophrenia, schizotypal disorder, bipolar with some psychosis, and autism as well, because we have to be careful with autism if somebody, because people on the spectrum can also have episodes of psychosis, breaks with reality. And we have to be very careful about that. But some of the other treatments, some of the other diagnoses, Safe and Sound is absolutely helpful with ADHD. I mean, ADHD is just kind of a collective diagnosis for kids that don't feel their bodies, right? Kids that come into my practice with a diagnosis of ADHD, I get a referral to an occupational therapist, a physical therapist. I give them SSP, and guess what? They had sensory integration problems. They didn't have ADHD. That's been some of the outcomes. So SSP is great for little kids with self-regulation issues, learning difficulties. Sometimes kids, their brains are just moving way too fast. Their thoughts, racing thoughts sometimes, and they can't slow down to hear. They can't slow down to listen. So sensory processing difficulties, people that have a trauma history. People with a trauma history, we really have to go slow because their central nervous systems are so fragile. Frequently, we have to go super, super slow. So, you know, here again, assessment, right? Headphones, as I said, are recommended for best delivery. We don't want earbuds. We don't want like little foam over the ear canal headphones. We want over the ear, fully encompassing the outer ear, so that the outer ear structures are also being used to capture the sound and capture the frequencies. Parents have got to listen before the kids do. I've had a couple of instances where very early on where I had the kids listen before the parent, because the parents didn't want to listen. The kids' states changed, their internal states changed. The parents didn't. The parents were consistently treating a child, talking about them with them being present, not realizing that the child was listening. And so there can be some significant disruption between child and parent. So I always recommend that the parents listen to Safe and Sound first, have their 8 weeks, and then have the child listen, not simultaneously. Those wonderful group sessions that my colleague Sherry in Florida does, all the parents, everybody's done Safe and Sound individually before they've done it in a group. Next, Christine. So I love this image of the dandelion. And I think that as we heal with Safe and Sound protocol, our relationships, our boundaries change. And when our boundaries change, other people's boundaries change. When we heal ourselves, we are actually engaging in healing relationships with other people. My email address is at the top there. More than welcome to contact me directly for further explanations about Safe and Sound protocol, how we get started, how you can take advantage of this grant between now and next April. What is the SSP is a great link for you to educate yourself a little bit more about Safe and Sound. There's some great little video clips, Alan Shore, Pat Ogden, and Dan Siegel through Polyvagal Institute. They're just like maybe 30-40-second little video clips that I think would be important for people to watch. Parents listen before the kids. We've got to strengthen the self-regulation skills of all of the parents before the kids are engaged. I use an autonomic screener for the adults, and then the assessments for kids are on the SSP website, on the dashboard that you would that you'll find once we meet. We do an assessment before, and then we do another assessment after the 8-week wait in between rounds. Why do we wait 8 weeks? Well, neuroplasticity takes time. Norman Doidge, who wrote The Brain That Changes Itself, I attended a conference where he was did a workshop, and he talks about sensory organs being energy transducers and the genesis of neuroplasticity. So we talk about neuroplasticity, but we don't talk about how it happens. Neuroplasticity happens through our sensory organs, right? We hear music, we see, we smell, we taste, we take in information. That information is changed into an electrical signal that travels through all those cranial nerves. We make meaning out of it. And as our meanings change and our perspectives change, that's neuroplasticity. So function over time will improve as you listen to Safe and Sound. So we issue a license, right? When you sign up for SSP, you own that license for a year, or up until April of next year. That license will belong to you for the duration of the grant. And you can listen to SSP as many times as necessary within that time frame, given your treatment plan. While the SSP access is at no charge, there's no fee for it until April of next year. I will bill insurance companies just for our sessions, Zoom sessions or face-to-face, however that works out. But otherwise, access to Safe and Sound for the duration until 2025. Typically, just to kind of give you an idea about what clinicians charge for access to Safe and Sound protocol, for a year's access in some areas in the US, it's up to $1,500. So having this opportunity for this grant is such a gift. And I'm really excited to be able to offer it to everybody as you want, as you need. Feel free to email me at any time, and I'm happy to review it with you, see how you want to proceed with it. And you can tell other people about it. Anybody in the Commonwealth of Virginia is eligible. So tell your friends and family. Any questions? Any comments?
I wanted to say that I put those links in the chat, at Jane's email address and the 2 links that she put up there. And I wanted to say that I'm a big proponent of the headphone technique. I was traveling last week and I hate traveling. So at the airport, I put my headphones on, listened to 15 minutes, drowned out everything else. I was able to get calm before I got on that plane. So I'm a big fan.
Great. Wonderful.
Yes.
I look forward to the second round soon here, Jane. So
Yeah, Marilyn, you're coming up for your second round.
I think it'll be awesome.
Yeah, I think this is just a tremendous opportunity for families in our community. And so I'm really hoping that, you know, through the ARC and through the Mental Health Association, that with their reach out into the community, that more families can be aware of this incredible opportunity through the grant. I mean, this is astonishing to me that, you know, that Jane, you were able to get this, and, you know, and I just really wonder if people recognize just how significant this is. And what a great opportunity. I'd hate to see people miss out on it because there is a time limit to it. I know they still have time, so hopefully we can spread the word.
Well, each one of you is a seed in that dandelion. When you heal, every interaction that you have with other people is healed, and you pass that healing on to someone else. And that, to me, is the power of Safe and Sound protocol, is that even though someone else may not be engaged in Safe and Sound protocol, your own individual healing is going to affect the impact, is going to impact the relationship that you have with others. And so I think about the dandelion. Wouldn't it be wonderful if we all had dandelions and we just blew
Right.
sound all over the place from here
And
to
I
my
hope-
back again, right?
Yeah.
I hope the other 30 folks that were signed up here watched the video too. So we had almost 40 and signed up, but of course, you know, you don't get everybody to show up. But I think even if half of those guys will pay attention, you know, and get the information, that'd be great. So
Well, and particularly the people from schools, because I think that the school systems really could use Safe and Sound protocol for like their sensory rooms. When kids are overwhelmed and they need to go to the sensory room, they could have balance playing on in the background you know, you're going to have parental consent, and all of those things are going to have to be incorporated.
Mhm.
But what a gift that would be for a child who is, you know, task avoidant, or, you know, one of my, you know, schools label kids, right? And this is, we don't
Well,
want.
forget about the students. What about the teachers? The teachers could probably
The
benefit,
administrators.
get themselves
Mhm.
self-regulated before they go into that classroom. I mean, really and truly.
Court system. I mean,
Yeah.
those of you who know me know that I'm a big court advocate, and I work with a lot of attorneys and judges. And you know, they're referring people to me too.
I mean, even the C Center in Culpeper has a room, a sensory room like that, you know, people in recovery, not even just from substance use issues, but mental health issues.
Right.
Having a dark room where you could really kind of drown out the noise of life and listen to something calming, I think it would be fantastic.
Well, and
It's
senior
definitely-
centers, yeah, senior centers with people with dementia.
Mm-hmm.
And
Yes.
I don't know about dementia. Anne, has there been any research on using Safe and Sound protocol with people with dementia?
Yeah, it's not published yet. It's soon to be, but we are seeing promising results. Yes. It
Right.
doesn't reverse the dementia, but it helps to improve the functions of daily living. Because there can be a lot of stress and anxiety that comes along with the onset of dementia. So yeah, really promising results.
Oh,
Good.
great.
So can anybody refer someone to you? by just
Absolutely.
using just your email address?
Just
Okay.
my email address. And I will administer the assessments, you know, to look at goodness of fit, right? You know, sometimes people are in points in their lives where SSP isn't appropriate, but it's something that they can put in their back pocket
Mhm.
and access when they're ready. You know, we don't really recommend SSP when there's huge transitions or, you know, surgical procedures, you know, those sorts of things. There has to be some stability and willingness, right? Right.
Mhm.
You know, people have to
And-
be willing to try something that's very, very different. And you know, a lot of times people frequently think, oh, it's just a, you know, just send me the link on Spotify. I know what, you know.
And on that note, Jane, if you don't mind, if I could add, when we're working with clients and providers, the number one factor that we consider to be the most important is the relationship between the provider and the client, and the provider's expertise and delivery. And there's a broad range of delivery expertise when we look at providers of the Safe and Sound protocol. And as a company, we work to certify and have everyone be top notch, but that's impossible. And I know, and anyone who's working with Jane is going to find that top notch practitioner, and that relationship is of paramount importance. So I spoke to someone yesterday, and I was like, I wish we could just put SSP out on the street corner and pipe it out, but that's not what the SSP is. The SSP is a relationship. It's all about co-regulation, and to find a provider with the heart and soul of Jane is a gift. So thank you, Jane.
Thank you, Ian. Well, you've contributed to nurturing that, believe me.
Happy to be a part of it.
Mhm.
Any other comments?
I would love to be able to gather some responses from anyone who has some positive feedback and keep us communicating as a group and updating each other and helping get this out to as many people as possible. But I think hearing from people who've seen changes would be fantastic.
Absolutely. Absolutely. And some of you have listened, and you know, I've gotten some feedback from SSP, I'm going to say, is a HIPAA compliant program, right? The website is HIPAA compliant. So you know, there's no risk of me sharing your information. And it's all highly confidential. So but it would be nice to have some people share their experiences at some point.
Yeah.
And I'm more than happy to come back in a few months and do this again. Feedback from people who watch the recording, constructive criticism is always available too. You can't hurt my feelings.
Yeah, that would be fun to come back after people have completed it and just have, you know, some people tell their experiences with it. So let's keep that in mind.
Absolutely.
Thank you for your time,
Thank
everybody.
you, Marilyn. Thank you, Christine. Thank
Okay.
you, Renee. Thank you,
Thank
everybody.
you, Jane.
Thank you.
Take good care. Thanks, Anne.
You too.